And I'm just going to use the same PRN adapter that was here. So let's say initially what we're doing is we're going to discontinue this one because we've noticed that it's red and the patient's complaining of tenderness. Okay? So clean gloves to discontinue. You want to loosen all of your tape. Go ahead and loosen your tegaderm as well, but don't pull it out. Okay, and then once you have that tape pulled back, you want to just expose the site slightly, take a look at it, go ahead and swab in concentric circles around there so that's clean. Take your 4x4, 2x2, or cotton ball, whatever you have, and with a no-touch technique, you're not touching the inside here, you're just going to lay it on top of your catheter. Pull the catheter out the way it was inserted, okay? Then you're going to hold pressure, normally 1 to 2 minutes. What about if the patient's anticoagulated?
5 minutes.
5 minutes, right. So hold firm pressure, and while you're doing that, you're going to check the end of your catheter. Make sure it is not jagged, that it looks prematurely short, or anything like that, that looks like it's intact. Occasionally, catheters do break off in people, okay? Not good. But both with a peripheral line or a central line, if you're removing it, you want to check the intactness of the catheter. All right, so you hold it, make sure that it's not, bleeding or bruising up. Wait your 2 minutes, and then what I usually do is I just fold my gauze over here and put a piece of tape across it. Tell the patient they can take it off in 20 or 30 minutes. It's just to give it a little bit of protection until it completely closes. Okay?
You like the whole box for the semester.
All right, I'm going to open up my kit without contaminating the inside because I'm probably going to want to lay my lock in there once I get it connected here. So wash my hands. Clean gloves for IV. You just don't want to touch your insertion site. You may have a policy in the hospital where you're using sterile gloves, but your book says clean. Most places let you use clean gloves. Some of your IV start kits will have sterile gloves inside them. If you're provided with that, go ahead and use those. All right, so I want to go ahead and clean off the end of my adapter, here, and connect. And I want to go ahead and flush through. And then I want to place the end of this somewhere in a sterile place until I need to pick it up again, okay? So I just don't want it touching anything that's contaminated. I leave the syringe on because it's a little easier to manipulate once I get this in. Okay, so now go ahead and others, it's your choice.
Right, apply the tourniquet around the arm above antecubital fossa 10 to 15 centimeters or 4 to 6 inches above proposed insertion site.
Okay, about 4 to 6 inches above usually the antecubital or the elbow. And you have to have enough stretch that you're actually compressing the arm. So you want to hold one side, kind of just taut, and stretch and pull up on your other side, all right? While it's stretched, you're just doing a half, kind of a half bow under here. And you leave one end that you can just pull and it's going to release it. You don't want to tie it into a bow. So just that one loop that goes under with it stretched out.
It says
right.
Don't apply the tourniquet too tightly to avoid injury, bruising skin, or occluding an artery. Check for presence of a radial pulse.
So as soon as I put the tourniquet on, I'm going to start timing myself. I don't want it on longer than a minute. That will fail you next week. You want to check for a radial pulse. Okay?
Sorry.
Radial pulse. Make sure that, that you're not obstructing the blood flow. Okay?
Okay, and then
But you want to locate that. If you're having trouble locating it, then you can have the person drop the arm next to their side and let the arm fill up with blood. You can apply warm compresses to their arm to try to bring the vessels up. So you can also do a little bit of massage, distal to proximal, to try to fill or engorge that vein. All right?
No tapping.
No tapping. Why do I not want to tap?
You'll make it collapse.
You don't want
Yeah,
to.
and it can cause bruising. It often will cause bruising because you end up injuring the vein somewhat before you stick it, and then it bleeds out around it. So you can do that. There are lots of little tricks that are safe. No tapping, but you can do the massage. You can do the warmth on the extremity. You can do the dependent position. So this should not be on longer than a minute. So I should identify, immediately release. We have you put the tourniquet on, find your spot, release the tourniquet, clean, reattach your tourniquet, stick, and release the tourniquet. Okay? Does that make sense to everybody?
So is that what we should do for testing?
Yes.
So we'll
On,
Clean it.
find my spot,
Okay,
check
I
my
got it.
radial pulse. Okay, release the tourniquet. I know where I'm going. While the tourniquet's released, I'm going to clean,
Stick.
then reattach the
Reattach
tourniquet.
it? Oh, okay.
All right, so cleaning. Okay, in your packs you have a ChlorPrep. So I'm going to take this out. You just pinch these together to get them to release the fluid. Hold it upside or downside with a sponge so you saturate the sponge. And then you're going to use a horizontal cleaning. Then you're going to go vertical. Then you're going to go circular. And what did the book say about chlorhexidine? How long do I let it dry?
30 seconds.
30 seconds, right. If I'm using an iodine prep, it's 2 minutes. All right, so while that is drying, I want to make sure I've got everything here I need. I've got my needle, got this all ready to push in. I usually use a gauze pad to slip under there when I'm switching the needle out. I'm going to get my Tegaderm up here where I need it. So I can just reach over for that. Okay, that's probably been my 30 seconds. All right, I'm going to reattach my tourniquet. And I'm going to pick up my needle here. All right, I want to turn it with the bevel up. Okay, just like you do when you do your intradermals. So bevel up. I want to take my thumb of my non-dominant hand to pull down. I'm going to stick about 2 inches above that. Okay, so okay, I've cleaned this area. Just put my tourniquet back on. Let's see if we have better luck this time.
Is the blood on so you actually get flashback?
Should be. I was getting
Nope.
it earlier. Oh, there we go. Yeah.
Yay! Flashback.
All right, once I see my flashback, okay, I'm going to lower my catheter. I'm going to position my forefinger up next to that little tab, and I'm going to begin to introduce the catheter. So you'll see that I'm pushing forward with my forefinger and kind of backwards with my thumb all the way down to the hub. All right? As soon as I get that in, I'm going to hold just the hub, not put my fingers on the site. Just hold the hub there. Reach over. Try not to touch the end of that. Disconnect this. Oh, I got it in good this time.
What do we?
Aren't we supposed to occlude above?
Yeah, you can use your third finger up here to occlude. And what I sometimes... Okay, as soon as I get it in and I'm connected, I'm going to go ahead and pull my tourniquet off. Then I'm going to slowly flush my IV.
To make sure it doesn't infiltrate.
Right, and I'm watching to make sure I don't get swelling, infiltration up there. And now I'm ready to put my Tegaderm over.